Think about your heart for a second. It's the most reliable engine you'll ever own, right? It beats over 100,000 times a day, pumping blood to every single corner of your body, and it never takes a break. But what happens when this incredible pump starts to, well, lose its power? That's exactly what we're going to break down today: congestive heart failure.
So here's our game plan for this explainer. We're going to start with what it actually means for the pump to fail. Then we'll get into the two main ways that can happen. From there, we'll trace the problem from the left side of the heart all the way to the right. And finally, we'll wrap up with how we can fight back. All right, first things first. That term, heart failure, it sounds absolutely terrifying, doesn't it? But it's important to know it doesn't mean the heart has just stopped working. It means it's not working as efficiently as it needs to.
At its very core, heart failure is a supply and demand problem. Your body is demanding a certain amount of oxygen-rich blood, but the heart, well, it just can't keep up with the supply. This creates a backup, a sort of traffic jam of fluid, and that congestion is exactly where the name congestive heart failure comes from. Now, what's really fascinating here is that the heart can fail in two totally distinct ways. You see, it's not always about a weak pump. Sometimes the problem is actually with filling up with blood in the first place. So you've got two main culprits: a pumping problem and a filling problem. When the heart can't squeeze hard enough to push blood out, that's called systolic failure. But if the heart muscle is too stiff and can't relax enough to fill up properly, that's a filling problem, and we call that diastolic failure. So to figure out if someone has that pumping problem, systolic failure, doctors look at this one crucial number. It's called the ejection fraction. And really, it's the single best measure of the heart's pumping power. Okay, so how does it work? It's actually just a simple percentage. Imagine the heart's main pumping chamber, the left ventricle, is like a little water balloon. The ejection fraction is just the percentage of that blood that gets squeezed out with each and every beat. You just divide the amount pumped out by the total amount inside.
Now, here's something you might not know. A healthy heart doesn't actually pump out all of its blood with each beat. A normal, efficient pump will push out just over half, more than 50%, of the blood in the chamber. That's what we call a healthy ejection fraction. So this is the number that really matters. Once that pumping percentage drops below 40%, that's the threshold. That's when doctors officially diagnose systolic heart failure. It's a crystal clear sign that the heart muscle just isn't contracting forcefully enough.
But here's where it gets a little weird. With diastolic failure, remember that's the filling problem, the ejection fraction can look completely normal. How is that possible? Well, it's because the stiff ventricle doesn't fill up with much blood to begin with. So even if it pumps out a high percentage of that small amount, the total volume of blood being moved is still dangerously low for the body. It's a sneaky one.
So how does this whole process usually start? Well, the problems often begin on one side of the heart. And most of the time, it's the left side. You know, the heavy lifter that's responsible for pumping fresh, oxygenated blood out to the entire body.
A really common trigger is high blood pressure. Think about it. The left ventricle has to work way harder to push against all that pressure, so it bulks up, just like a bicep at the gym. But this new, thicker muscle needs more oxygen. The problem is, the arteries that supply that oxygen can get squeezed, reducing the supply. So you've got more demand, less supply, and that equation leads to a weakened muscle. And that's systolic failure. So what happens when that left ventricle can't push blood forward like it should? You get a backup, a circulatory traffic jam. And where's the first place that traffic backs up? The place the blood just came from, the lungs. And this fluid backup in the lungs, what we call pulmonary congestion, causes the absolute classic symptoms of left-sided failure. People feel short of breath, especially when they lie down flat. With a stethoscope, doctors can actually hear crackles in the lungs. The pressure can even cause tiny blood vessels to burst, and what you get are these heart failure cells, which are just the body's little cleanup crews gobbling up the leaked blood. But the problem doesn't just stay there. See, the heart is a two-part pump working together. A problem on the left side is almost guaranteed to create a problem for the right. That traffic jam is about to get a whole lot bigger. Get this, the #1 cause of right-sided heart failure is left-sided heart failure. It's a domino effect. All that backed up pressure in the lungs makes it incredibly difficult for the right ventricle to do its job, which is to pump blood into the lungs. It's like trying to push your way onto an already jam-packed subway car. So let's put it all together. It's a clear progression. Left-sided failure causes a backup into the lungs, which gives you shortness of breath. That pressure then causes the right side to fail, which causes a backup into the rest of the body, leading to swelling everywhere else. It's lungs first, then the body.
And the signs of this body-wide backup are very, very visible. You can actually see the jugular vein in the neck bulging out. Fluid can cause painful swelling in organs like the liver and spleen. It can build up in the abdomen, and, most famously, it causes something called pitting edema, where the swelling in the legs is so bad that if you press on it with a finger, it leaves a little pit.
Okay, so now that we understand the problem and how it snowballs, the big question is, what can we do about it? How do you actually help a heart that's struggling to keep up?
Well, the good news is, while heart failure is a serious chronic condition, there are a lot of ways to manage it, to improve symptoms, and to help the heart work a whole lot better.
The treatment plan is like a multi-pronged attack. First up, medications. Some, called diuretics, are basically water pills that help your body get rid of all that extra fluid and reduce the congestion. Others relax your blood vessels, which lowers your blood pressure and just lightens the heart's workload. For more advanced cases, you have devices. Special pacemakers can help the heart's chambers beat in sync, and ventricular assist devices can be implanted to literally give the heart a mechanical boost. And finally, as a last resort, there's the option of a heart transplant.
You know, understanding how this incredible engine works and how it can fail is such a critical first step. It really leaves us with a big question to think about. Knowing the non-stop, unbelievable work our heart does for us, how can we do a better job of supporting the one engine in our body that never, ever gets a day off?